host, Michelle Evans. Today, I'm joined by Julia Bluestone, Technical Director of Learning and Performance at Jhpiego, and she's also a former Bowe Fellow. Hi, Julia.
Yeah, hi. Hi, Michelle. Thanks for making time.
Welcome.
Yeah,
So, Jhpiego is a Johns Hopkins affiliated global health nonprofit. They've been working with families and women for more than 50 years, over 155
mm,
different countries,
yeah,
with training frontline workers and things like that. So, for our listeners who aren't super familiar with Jhpiego, how would you describe what the organization does, why it matters to the global economy, and not just global health?
sure. Thank you for mentioning we are an affiliate of Johns Hopkins University. Been around a while, as you said, and we mainly work in partnership with governments in low and middle income countries across Africa, Asia, and Latin America to fill like critical gaps in the health care system. We have historically done a lot of work with health worker education and training, often with a focus on maternal and child health, infectious diseases. And we focus heavily on helping countries translate evidence into practice. A lot of our work does help women.
Yeah,
A lot of women often benefit from our work, and healthier women lead to healthier families, which leads to healthier communities. And also, like, as we all know from Ebola, avian flu, COVID, like
hmm,
an outbreak anywhere is a public threat, a health threat
right.
everywhere. Malaria continues to really threaten economic growth in 13 countries across sub-Saharan Africa and Asia. And that has a direct
Oh,
impact on US trade and
hmm.
security. These things we think like, oh, global health like doesn't matter, but it does. It
It's part of
matters.
the big
Yeah,
picture.
it's part of the big picture. Nobody's like an island. Oh, you know it.
Yeah. So we saw on social that Jhpiego's Kenya office, is undergoing a new chapter. They've been active there since 1993, but walk us through this new leadership program that you have in Kenya for nurses. What gap does it fill, and why in Kenya, and why now?
Okay. I love actually love talking about this, and thank you for
Hmm.
making an opportunity. Partly because I am a nurse midwife, and I did benefit from leadership programs like Bowie, which was really great for me.
Nice.
So I'll start with the why. Like, why does
Hmm.
PIGO feel it's important to provide leadership opportunities for nurses? And this program actually, we describe it as a nurse leadership program, but in our cohort of 24 early career nurses, we have nurses and nurse midwives. Because in Kenya, you have nurses and you have nurse midwives. In our cohort, we
Right.
have some of both. So this matters because in 2025, there was a global report, the State of the World's Nursing Report, and they identified in low and middle income countries, only 25% that reported in their data reported having leadership program opportunities for nurses. Um, and we also know that burnout rates are really high, especially not only for nurses, but also for midwives who face very stressful working conditions with lives are at stake. A recent study from Kenya, I forget if it was 2023 or 2024, identified burnout rates from those surveyed as high as like 35%.
Oh,
And we
wow.
also, I know, right? And we also know that leadership programs can reduce attrition, can lead to reported improvements and lowering of burnout rates. So it matters. It matters
Yeah.
because it's a gap in the healthcare system. And we also know that nurses and midwives, they work intimately with the system and they understand it. And like all of us have worked, the difference when you're following a leader who understands exactly, what
Yeah.
you're trying to do, right? So um, for those reasons, that's why we felt it was important. And also just I'm sorry I'm taking a long time with this question. And
Oh,
I'll get
you're
more
fine.
concise in a minute, but it matters to frame it out because I do think it's important. And then I also want to mention, like, we've been around for 50 years, and over those 50 years, because nurses and midwives comprise the majority of the healthcare system, around 80% of the health workforce, especially in
Wow.
LMICs, um, we have worked in 20 different countries to strengthen nursing and midwifery education or health professions regulation. And we know how important it is, whether it's a recent project that just closed in Ethiopia, where we helped the nursing and midwifery and other like 7 different professional associations expand their digital continuing professional development, their new like learning management system from 3,300 users to over a 5 year period to over 50,000 new users. And that's not Jhpiego doing it alone. We always do that in partnership with these health professional associations and councils. So sorry, that was a long way of saying we think it matters because there's a gap, because we think that when nurses or midwives are given leadership opportunities, that we have lower attrition rates and that we see an impact on the quality of care and better outcomes for women and children. So sorry, I took a long time with that. Do you have any questions about any of that before I talk a little bit about the program, if I can have just a few minutes?
No questions. Keep
Okay.
going.
Okay, thanks. So about the program, we had a little bit of unrestricted money from a donor left, and we had worked the Sigma Theta Tau, which is a big, the international like nursing quality association, big association in the States. They had produced with Johnson & Johnson funding a new nurse leadership competency framework, and we had funding from a donor, and we created a nurse leadership toolkit. And so we had some leftover funds, and we used that to do our first like leadership development program. So you asked why Kenya, because we could have done it, in several countries. We're still in, I believe, 40 countries, but part of the reason is because the team I'm working with in Kenya is passionate about leadership, and we have the right relationships, and so they were willing to take it on because it wasn't a lot of funding, and we said let's do this together and make it work. So it's a blended learning program. We ran it over 4 months. We had started off with an in-person workshop to build relationship, make sure that they could access our moderated WhatsApp group and plan for the 4 month period. And then we offered regular webinars where they heard from other African leaders, I think all women actually,
Oh, that's cool.
leaders. Yeah, it was great on change management, on communication, on taking your place and not waiting for formal leadership, which can happen a long time in the places where we work. And then moderated WhatsApp groups. And then we had micro cohorts of 5 to 6 with a mentor with each one, and then one-to-one meeting. So it's a blended program. And actually, tomorrow and Wednesday is the culminating event, in-person event for this cohort of 24.
Oh, that's
And
cool.
yeah, it's been nice. Like, I feel like as a director, a lot of my work is quite upstream from the
Mm-hmm.
people that benefit. And because this is the first time we're doing it, so I'm one of the mentors on the team, and I join remotely and help find the speakers. And it has just been incredible. Like the stories that we're hearing, and we purposefully targeted, sorry, Michelle, I forgot to mention this. We purposefully targeted early career nurses and nurse midwives because that's where
Mm,
attrition is the highest. And there's also not a lot of opportunity. There's
right.
other like leadership programs for executives, but we were like, we really want to reach early career nurse and midwives.
Coming
So
in the
these are,
door.
yeah, these are clinicians that are working in like, some are working in really remote, like I did a one-to-one with my mentor like last week, and he was like, look at, he works in this very challenging little health post, but he has this beautiful view of the ocean. He's like, look at that. But it's been really amazing. I did not expect in 4 months, that we would see the type of personal transformation stories that we're hearing from our small cohort. So it's just been really, really a joy. Sorry, I took a long time to answer that question.
That is okay. That's amazing. You get to see what it's like to be in like one of these leadership programs on both sides.
Yeah, yeah, exactly, exactly.
So you were mentioning that nurses make up like a pretty large
Yeah.
segment of the global health workforce. Shout out to my sister, she's also a nurse.
Woohoo!
Um, but as you mentioned, they are underrepresented in a lot of these decision-making roles, which can affect like policy, funding, patient outcomes.
Mm.
When nurses step into leadership positions, what changes occur, not just inside hospitals, but at the policy trade levels? What does success look like for this program in 5 years?
Mm. So let me answer the first question first, and then I'll answer the second
Hmm.
on success. So the first, but what happens when nurses or nurse midwives are in charge is one thing is they're catalysts for change. So like anecdotally, from and we are doing like a formal survey with this cohort because we haven't run this program before, and I really want to hear what's worked and what hasn't. But some
Right.
of the things that we've heard from this group already is like one instituted like improved infection prevention control, quality improvement initiatives within her NICU like unit.
Hmm.
One instituted realized like, hey, we're not really doing well with immediate breastfeeding within the first hour, which is really important for the newborn,
Yes.
and has implemented changes where she, shared in the chat how she's been able to change that within their unit, so that now they've increased their percentage of babies that have immediate breastfeeding. So one is like it results in you know immediate improvements in care. Also in
Hmm.
2025, there's a survey of nurse leaders, and 8 out of 10 reported that they were piloting new care models to address staffing shortages or improve efficiency. So those type of changes, make a direct impact
Yeah.
on facilities. And I don't think you're going to see the same, from a leader that doesn't understand what it's like
Hmm.
on the front line.
Yeah. They're not
As,
in it every day.
yeah, exactly. And as far as the impact on policy changes, now I'm speaking about our cohort, but also like I've been, at Jhpiego 25 years. I've worked, I think I would count it up probably over 30 countries, and I often have worked directly with nursing and midwifery councils or associations in those countries. And if you look at UNFPA produced a State of the World's Midwifery report for I forget when the last one was, but they did one on West Africa, which isn't published yet, and another in East Africa from 2024. And what they find
Mm.
is there is a lack of the voices of nurses and midwives at the policy level. And what that means,
Mm.
Michelle, is like when we have things that are evidence based, like nurses can provide antiretroviral therapy for HIV care, right? If they're not at the table, then it's very hard to get those policy changes. So,
Yeah.
yeah, so having them at that policy level can make changes at the country level. And lastly, what success looks like. Now, I'm going to answer this in a selfish way, like
Okay.
globally. Okay, so first I'll start with like the public health lens, which is like success looks like more nurses and nurse midwives in leadership positions and having
Hmm.
at the table so that they can be part of creating policy in the countries because they are the majority of the health workforce. I don't know if, well, you probably didn't see because it's a public health thing, but there was a report called Delivered by Women, Led by Men, which is about the fact that most of the health workforce is women, but
Yeah.
yet there is a lack
Yeah.
of women in leadership.
Leadership.
Yeah, at the global level. But so at the big scale, we want to see more nurses and midwives in, policy positions and representing their profession. But at the selfish level, I would say I would love to see us bring in additional funding so we can do this in other countries. It wasn't expensive. Another thing for me that would be success is that we implement in partnership with local partners. So, for instance, in Ghana, we've worked with CHAG, which is the Christian Health Association of Ghana. We've worked with faith-based private facility networks and non-faith-based private facility networks. So I would love to see us doing this in partnership, side by side with local organizations And lastly, I want to see the community continue to thrive. Like our small cohort of 24, everyone we issued a survey like how do you want to stay engaged after A, B, or C? Choose all that apply.
Right.
Everyone wants to stay part of the WhatsApp group. Um,
That's amazing.
yeah, so that's big picture and also my selfish wish for success.
Hmm. I mean, it's kind of a good sign that they want to stay involved
Mm,
with it. It means that something's going right.
yeah, yeah.
So we spoke briefly before we started about the global health organizations navigating this complicated shift in foreign aid priorities, the
Mhm.
dismantling of U.S. aid, they're shifting into the State Department. And, how is Jhpiego adapting to this current global health funding environment? And what does it mean for programs like the one in Kenya?
Mhm. Thanks for that question, Michelle. I will say, like, we've been around for 50 years, more than 50, and
Mhm.
somehow I've, you know, been there for 25, amazingly. Um, and, through our past and even from my recollection, we've been through many different funding fluctuations. So we have built flexibility and I would say resilience into our operating financial plans. I also feel like, I I work with some of the most adaptive, committed, hardworking people like I've ever met. And so people
Mhm.
are resilient, it's just like roll up your sleeves, do the work.
Mhm.
We're expanding our work in private sector in the countries we support. We still lead local innovation and incubation platforms. There's the WISH platform, Health Tech Hub Africa, which are both focused on, we support Trinity Challenge, we're both all focused on incubating and supporting local companies to take new innovations. Often there's technology involved to scale. And then something we're really excited about is we're facilitating new ways of financing to solve like priority public health problems through
Okay.
collaborative funding or collaborative impact efforts. And I could give you there's something we just launched last month called the Healthy Birth Initiative in India and Kenya. And this is done in total partnership and support of the India and Kenyan governments that want to reduce the rates of low birth weight babies and improve newborn health outcomes. So, for instance,
Mhm.
in India, 1 in 5 babies is underweight at birth. And if you're underweight at birth, you're 20 times more likely to die in the first month of life,
Oh,
right?
wow.
So, yeah, so the Healthy Birth Initiative is a collective action platform for accelerating reduction of low birth weight babies and improving outcomes for small and sick newborns. So it's under the leadership of the governments, and most of the bulk of the funding is their,
Mhm.
committed investment. But we're also trying to catalyze funding with expanding local innovations, mobilizing more philanthropic funding, and also generating learning to share across countries. So we're looking at different ways to like bring finances to the table, all under the local leadership of the priority health problems they're trying to solve.
So where do you see the biggest opportunities for the private sector and these international business communities that want to engage and work with Jhpiego?
I, obviously supporting the work, 88.5 like cents of every dollar that's philanthropic like goes directly to programs. The other thing is like
Mhm.
staying connected. Maryland has a thriving tech and energy industry, and we do, like I
Mhm.
said, we support like multiple small local organizations that are trying to expand technology. So also, and we're across many countries in Africa and Asia. I think I saw that world with the World Trade Center, Nigeria,
Mhm.
India, and there's another country that we're present in that, of course, I'm spacing on right now. Are trade partners. So
Yeah.
please stay connected with us on social media and look for those opportunities because we are, like Michelle, like more than ever, we're trying to look at non-traditional partnerships.
Yeah. Got to think outside of the box these
Yeah.
days.
Oh, for real. Yeah. Everybody.
So I want to shift gears. I mentioned that you went through our Bowe Fellowship for our global executives.
Mhm.
What made you apply, and what do you think you still use today that you learned while in that fellowship?
So, our president, our recently retired president, like Leslie
Leslie.
Mancuso, yeah, she's
Yeah.
a big fan of the program and suggested it to me. I was a team lead, I think the health workforce team lead at the time. And I thought, okay, this would be good because I'm really good at getting things done, but I
Hmm.
felt like I really could do better about being a strategic thinker, more visionary. How can you be bigger picture? Um, so it was a combination, her recommendation, which I appreciate, and my wanting to like take my game,
Hmm.
up a level.
Yeah.
Yeah.
So would you say like some of the things that you learned with the Bowie Fellowship, did you try to emulate within your leadership program at all?
Yeah, well, I think I'll offer something. One for me, a couple things I took away from it was I did feel like I it was helpful at learning some strategic thinking skills, like what makes a good vision and strategy. Some great things on negotiation and change management that have stayed with me. Um, and also that sense of we're going to create this space for you and reaffirm you as a person. And this is so touchy feely, but I really feel like it mattered, because the way you perceive yourself influences like the way you act in the world. And I think for me, it was, yeah, it just made a difference in how I engaged in the world. And that's what we're seeing in our cohort is feel like it has given them a sense of like, I'm going to take my space and use my voice without waiting for permission in a way that's been lovely to see. And then you asked the other thing I'll answer is did it inform like the way we
Hmm.
design this program? And yes, like definitely, especially in like tapping into external like local leaders. Like
Hmm.
we found women from that had supported that went through a program called Women Lift Health, which does a very robust like leadership development program, and also adaptive change advisors who we've worked with in the past. So we identified, you know, local leaders. So I pulled that because I really enjoyed that about
Yeah,
the
that cross
program.
industry
Yeah,
model. Yeah.
yeah.
So for someone who's listening and they want to support this kind of work that Jhpiego does, what's the most useful thing that they can do?
Uh, Most useful, I would say, stay connected. So that we're just looking for non-traditional ways, and then support the work. Like if there's something that you're passionate about, contributions are always great. And yeah, those are the two things.
So thank you for coming and chatting with me today. So why don't you let people know how they can find you and how they can connect if they want to get involved?
Sure. LinkedIn, Julia Bluestone. Yeah, and follow Jhpiego's social. And then we have, if you're interested in a specific country, Jhpiego India, Jhpiego Kenya, Jhpiego Ghana, you can follow that country LinkedIn specifically, and then you can stay a little bit more looped into maybe possible opportunities in country. And we're always open to that. But thank you, Michelle, for making time. I appreciate it.
Thank you. I appreciate it. And thank you all for listening. For more information on member news, insights, and events, visit WTCI.org and be sure to follow us on all our social channels at WTC Institute. Until next time.